Hi, folks. Voss here from the Chris Voss Show.com, the Chris Voss Show.com. Hey, coming to you here. We're coming to you with another podcast. We certainly appreciate you guys tuning in. Be sure to give us a like, subscribe to us on YouTube, hit that bell notification button so you get all the wonderful notifications of all the stuff we're doing here and all that good stuff. So today we have a most excellent guest. I think you're going to learn some really important stuff, especially about your health. And health is important last time I checked, especially in your old age and with all the stuff that's going on. Today, we actually have a doctor on the show, so we're going to get really smart. His name is Trevor W. Turner, MD. I got to get used to saying MD there. So Trevor is a board-certified physical medicine and rehabilitation physician who specializes in minimally invasive image-guided orthopedic procedures to place steroids, platelet-rich plasma, and stem cell injections into damaged tissues and help patients recover faster with a lower risk. You've probably been hearing about a lot of this stuff lately. And we're going to find out why he is passionate about healthcare, entrepreneurship, and serves as an advisor and strategic partner to numerous startups focused on disruptive innovation in medicine. So we're going to learn a lot. It has to do with startups and all that good stuff. Welcome to the show, Trevor. How are you doing today?
Hey, thank you so much for the introduction, Chris. I'm fantastic. I appreciate you having me here, and I look forward to discussing what it is that you introduce.
Awesome sauce. So give us the .com so people can take a look you up on the website.
Sure. Our practice website is Georgia Bone and Joint, all one word, .org, O-R-G. And if you head to that website now, you'll probably see on our landing page, the first thing that pops up is regenerative orthopedics with a button to click through and learn more. We do have people book actually our clinic appointments directly from the website, but if you just want to go to learn more, you can click there and we'll be happy to have a consultation.
So I'm going to assume you guys are in Georgia. Is that correct?
Yeah, that's correct. We're on the south side of Atlanta. So we're about 25 minutes from the airport, which actually is much less traffic than all of the horrible things you hear about the northern part of the city. So, and so we actually frequently do have people fly in for care. And so they'll fly in, and we even have a car service that'll help pick up patients at the airport, bring them to our facility. We're really fortunate to have everything under one roof. So here in a one-stop shop, we've got physical therapy. We have our own imaging and MRI center. We have a clinic, and we have a dedicated team of 6 different orthopedists with PAs, and then myself as a minimally invasive non-operative specialist, and also have our own ambulatory surgery center. So we actually do same-day procedures right there, all under one roof, with the goal of getting people the care that they need, but doing it in a way that's very efficient and very customer-centric, so involved around giving people the highest level of satisfaction. So,
awesome sauce. So any people anywhere in the world or anywhere in the nation can fly to your facility and get help. And so what do you guys do that helps people?
Yeah, so I would say, we have a lot of different subspecialties within orthopedic surgery, including pediatrics here, which there's not a lot of pediatric orthopedics floating around. But then we have other specialists in foot and ankle, as well as sports and outpatient joint replacement, and are actively recruiting a new hand physician here. And then myself, I am as you mentioned, I trained in physical medicine and rehabilitation. And so that is really a specialty in which we sort of kind of toe the line between somebody who practices sports medicine or pain medicine, but does so in a way that's less invasive than open surgery. And so most of the care that I deliver, if it's going to be involved with a procedure, it means it's being done either with an ultrasound probe, which is great because there's no radiation with that kind of treatment, or an X-ray machine if we need to for advanced cases. And then the patients go home the same day, and we usually couple that with a very advanced type of rehabilitation protocol that's tailored to an individual person.
Awesome sauce. So if I'm having like knee trouble or bone issues, I know my mom has bad knees in her old age. She's had to have several different injections in her knees. In fact, she just had one replaced. So you guys, it sounds like a lot of what you guys offer is a way to make those joints and bones work. Do you guys do the full replacement, or you guys just do like the stem cell stuff and all that?
Yeah, no, I tell people that basically there's 5 ways that we can help them. And, knee arthritis is one of the most common reasons that people come to the doctor in the United States today. So that's a good example. So Generally, we try to start with things that are less risky. So we go from changing your exercise program or physical therapy and low impact exercise. We also look at even what you eat and, whether you're getting enough anti-inflammatory food with, be that vitamin D or omega-3 fatty acids, et cetera. Then we look at medicine, if that is something that people need. And, kind of the standard of care for the treatment of arthritis would be taking anti-inflammatories. And those medicines do help some people, but there's a lot of people who are motivated not to take medicine on a daily basis, or they're very aware of a lot of the side effects. So, for example, anti-inflammatories, while they can help reduce pain, oftentimes they lead to side effects with ulcers in the stomach, or even problems with kidneys at advanced age. And so, we use those, but we're always trying to be smart about risk and benefit. The next kind of standard of care would be injections. And so traditionally, if somebody hurts and has an arthritic joint, they would come in and get a steroid injection. And that's been done for decades at this point. But, really, there's sort of a revolution going on in medicine. And so the idea that we're going to take something that is, number one, synthetic, and number two, that may not really give you that long-term benefit. It may help you for a couple of months, but it doesn't last as long as people want. People are starting to kind of get, looking for a different option. And so that's kind of where the field of regenerative orthopedics, or some people call it orthobiologics, really started to come in, because we do joint replacement here. And when your joint, when you have no space left in it, and, it's what we grade knees on a scale based on x-rays. And so when you have grade 4 arthritis, you do need a replacement. That's the right thing to do. But we have a lot of people who are looking for another option. And so that option of regenerative orthopedics means that we use kind of a mix of things. And so probably the ones that most people hear about consistently are either the use of viscosupplementation, which is basically like the use of a kind of like a lubricant that goes in the joint. There's platelet-rich.
You can oil me up like the Tin Man from Wizard of Oz.
Yeah, right, exactly. And that is covered by some
oil juice.
Right, a little oil, yeah. And a lot of people call it rooster comb or chicken fat. They abbreviate it that way because that's how they actually create that. But I would say, more sophisticatedly are two other options that a lot of patients have questions about and are starting to see better longer-term benefits for. One of those is platelet-rich plasma, and the other one would be the use of stem cells, or specifically mesenchymal stem cells is the word for it. And we get those by taking, both of those, PRP and stem cell, we get those from taking them from a patient in a same-day procedure. And then based on FDA guidelines and compliance, we minimally manipulate them, which means we don't add any chemicals to them. We don't do anything other than basically put them in a machine, a centrifuge, and that's a machine that basically just takes whatever you put in it, it spins at a very, very high speed in order to concentrate the stuff that you really want to use. And so a lot of people have shown strong interest in the ability to be basically treated with their own cells, because they're saying, look, I'm tired of synthetic options. I'm tired of things that don't last as long as I want to. I don't want to be coming back and getting injections every 3 to 6 months. And then I think, when this field started to take off, I kind of felt the same way, because, it was great to help somebody and see them, for a few months get better. But I didn't want to see patients every 3 months for the rest of their lives to give them shots. I love seeing patients, but, the goal is always to maximize your function and to do so in a way that gives you the best long-term outcome. And so I think as we've started to focus on that more and more, we offer those options to people, either one, to, let's say, avoid joint replacement because they can get substantially longer improved function, or two, sometimes we do these procedures actually in conjunction. So a great example of that would be like rotator cuff repair, for example. We know that if you have a rotator cuff tear, and that if we take you to the OR to fix it with a scope or a camera, that if we actually combine that and we take stem cells from your bone marrow and we put those at the place where that tendon meets your bone, and not only do people get better faster in their recovery after the surgery, but actually their rate of re-tearing that, which is a major complication of the surgery, goes way down. And we actually have numbers that go all the way to 10 years out, which is really, really strong, because if you look at a lot of papers or evidence-based literature in medicine, you'll find that people go out to 6 months or a year or a couple years, but there's not a lot of data that goes out to 10 years. So when you get data that's that strong, it means, hey, not only do we have another option, but we're really focusing on options that last for the long term. And I think that's the standard that patients today want. And it's the standard that drives people to come in here, because they're looking for a way to either avoid surgery by doing something that's lower risk, that doesn't have the same level of complications, or they're looking to say, look, if I'm going to have a surgery, I don't want to have more than one. I want to be down one time, and when I recover, I want to do so as effectively as I can with less pain and better function, so that it's one good surgery done right without additional procedures or complications.
Awesome sauce. Why does stem cells work so well in this regenerative thing? I know at one time, I think the Bush administration outlawed research with them, and then they overturned that. And why do stem cells work so good at regeneration?
Yeah, so that's a great question. So it's interesting. So last week I went to TOBI, which is the Orthobiologic Institute. They have an international conference every year, and there were 83 different countries represented there and over 700 people. Really fun, because you just get to talk to all kinds of world leaders and talk to the people who did the initial research in the first place. And I actually spoke to Dr. Arnold Kaplan there, who used the first person to coin the term stem cell, actually. And so he developed this term, and the formal term for that is MSC, or mesenchymal stem cell. Why is it MSC instead of just stem cell? Well, that's because there's different kinds, right? You could get a stem cell from an embryo, which was the kind that, that was, what George Bush and his administration made the big rule about. You can get them from an umbilical cord, you can get them from fat, you can get them from bone marrow. And so for us, the type of cell that we're getting is not the kind that comes from an umbilical cord or an embryo. It's actually the kind of cell that comes from your own body. And so we happen to know that maybe that can't develop into as many tissues as you could as if you used a cell from an embryo. However, the kind of things we're using it for, it's perfect. So we're looking to help people with problems with bone, problems with cartilage, problems with muscle, tendon, and ligament, and maybe sometimes even also their discs or sometimes their labrums. So those are maybe some technical terms there, but the point is that we're taking the cells from a place that they become the things that we are targeting in particular. And so for us, it's a great niche to do so. And there's a lot of regulations in the FDA about what's permitted and not permitted. And you'll find plenty of people out there who are not practicing according to what the FDA stipulates. And in fact, last week in the New York Times, there was a huge article about actually a national company that has been shut down for doing things against basically what the FDA said was appropriate. Wow. And so everything that they stipulate, we draw kind of a very hard line on here. There's no gray area for us. That means that, number one, the cells are homologous and autologous. So that the explanation of that jargon is they're taken out of your own body. They're not taken out of anybody else's, and it's not an off-the-shelf product. It's all coming from you, number one, as a source. And number two, they're being placed under very advanced image guidance back into the same kind of tissue that they are somewhere else. And so for us, we happen to know that the yield, or basically the number of cells that we can get, at least when it comes to bone marrow, is highest in the back of the hip. And actually, that's one of the things that scares people in the first place when they're considering a procedure, is they say, oh my gosh, you're gonna take cells out of my hip. That sounds terribly painful. And what I have to tell them is, look, I have trained with some of the best people in the United States, specifically, I would say Dr. James Andrews, who I worked with for the last 4 years at the Andrews Institute of Orthopedics and Sports Medicine. I've taken care of everybody from professional to collegiate to amateur athletes to baby boomers to weekend warriors to special operators in the military, including Navy SEALs and Army Rangers, as well as Force Recon Marines and Delta members. So, it's not a problem of, can we do this for you and it's going to hurt you? We can do the procedure for you and not hurt you. That's not a question. It's the fact of, if you're going to come get a cell-based treatment or an orthobiologic, which those are the terms I really use for this field, is one, is it indicated? And then two, is the person who's going to do it really well qualified to do it for you well and the right way? And so we're searching for evidence all of the time. And so when we met Dr. Kaplan, it's interesting because the term that he coined, MSC or mesenchymal stem cell, he's actually called to change the name of that term. And so if you saw him at the last national conference, what he said was we should instead be calling these cells medicinal signaling cells. And we said, okay, well, why change the name? Why do you feel that way? When he expressed this, he said, look, there are, did I lose you there, Chris? Can't tell if we're still live or not. Looks like I'm good on the camera and the mic. I think I got the live button there, Chris, but I might have lost you.
Hey, Trevor, how you doing, bud?
Hey, Chris. Sorry, some technical difficulties there.
Yeah, I think it locked up. I restarted my machine so we could reset the cache.
Okay.
There was a point there you just barely started talking about a gentleman. I don't know if it locked up on your end or if it looked fine on your end.
Okay.
So if we can, just restart at that point.
Sure.
And we got a clean signal with the refresh cache. I restarted the Wi-Fi and everything. My apologies.
No, that's okay, man. I mean, that's technology.
Technology for you.
Hopefully.
Gave you a chance. It appears we're still recording. So
is that? Okay.
What I'll do is we'll finish the recording, then I'll bring it down, I'll cut it up, and no one will know otherwise.
Okay.
All right. So Trevor, there was a gentleman you just referenced. So I'll let you lead off with that.
Yeah, so that's Dr. Arnold Kaplan, and he is actually the guy who coined the term stem cell, or MSC. So it was great to talk to him at the Orthobiologics Institute conference as a world leader. And the interesting thing is he is actually recommending that we change the term. So he said, I would rather call these medicinal signaling cells. And so, people said, why the need to change the term? And he said, the concept that we take a cell and that it grows into something else, into the environment we put it in, may not even be completely accurate. But he said there's a very complex signaling cascade, or basically a whole process that occurs, that when you put these cells into an environment in your body, it sends an overwhelmingly strong signal for your body to do what it should do to heal. So let's say that you fall and you get a cut. And if you get a cut, immediately your body starts developing a clot so it can stop you from bleeding. And then it sends cells to those same place to basically change the tissue and then to relay a new scaffold, or to lay a membrane to build back the native tissue that you have when you get a scar, and then it goes away and it comes back to normal skin. And so the suggestion is that, the cells on the one hand are important, but these progenitor cells, or these cells, whatever you want to call them, not only is it just putting a cell into one place, but the fact is that it's sending a remarkably powerful signal for your body to heal or to recover in a way that profoundly affects the whole environment of the joint. And so a lot of people, I think, have come out and criticized steroids because they've said, well, look, in a lot of cases, we're injecting, one, something that's foreign, and two, something that's synthetic into a place in your body. And some of these places, as we've come to understand these diseases, don't actually have inflammation in that. And so if you're going to use something anti-inflammatory for a process that doesn't have inflammation, it's no wonder that that's not going to work well in the long term. And I think the idea that we can use either platelets or PRP, as well as the signaling cell or the progenitor cell or the stem cell, from your bone marrow back into a specific place that's been injured, has been something that we've found is changing outcomes. And the collection of outcomes data has now become critically important because we know that these type of procedures are new, they're innovative. We have a lot of good data on safety for the people who are adhering to the FDA's kind of definition and regulation. But the question is how long do they last? And a lot of people ask, well, hey, this is not covered by my insurance. Why would I do this? Or, look, if it costs a certain amount to get this procedure, and I've got to pay a copay and a deductible to go get a surgery done, why not just pay my deductible and go get my surgery? And so we have got to have the evidence to show people that, hey, not only is this a real alternative, but it's an alternative in a lot of ways that can maximize your function and help you achieve your goals with less risk, and oftentimes at a cost that is far competitive when you compare it to all the costs of what it's like to have a surgery, stay in a hospital, do rehab afterwards, be braced, miss work, etc. And so that's what we're all about, is helping you try to achieve your long-term goals with less risk in a way that's consistent with what your goals and expectations are.
Well, I think a lot of people maybe have a misnomer about steroids and what they are. They don't realize that your body has a natural steroid system operating within it.
Absolutely.
Yeah, I didn't even know that. I just always thought steroids were foreign until I had a girlfriend who had Cushing's disease, which is
oh my gosh,
cancer on the pituitary gland. And I was reading up to try and understand her cancer, and that's when I discovered that the body runs on its own internal system of steroids, and it pretty much operates you, really, or keeps you functioning, to my understanding.
It does, yeah. And it's just that when we're giving people injections with them, we're using an amount of steroid that is way in excess of what the body would naturally give itself. And in certain circumstances, that can be really, really helpful. But I think there's a huge number of circumstances that we're now going back and looking at it and saying, hey, this is not what the body does when it's in trouble. Should we really be doing this for people, especially in the long term?
Mm-hmm. This is the part of the show where, you doctors hate this when people do this to you, where it's called does this look infected, doc? But no, to bring up a topic that's personal to me is recently I started getting really bad tennis elbow, and a
Hmm.
lot of it is probably coming from my over gaming,
Mhm.
because that's when I kind of noticed it. But I've talked to some different friends that have had tennis elbow, because I asked my audience on social media. I said, hey, who's had tennis elbow, and what's the best way to
Sure.
come from? And a lot of people did respond to me that they had the steroid shot into their tennis elbow, and like it's been fine ever since.
Mm.
So the stuff does work.
Yeah, so I would tell you, at least in terms of randomized control trial data for tennis elbow, number one, I'm usually seeing patients who've had tennis elbow that's failed kind of usual treatments.
Mm.
But what we found in some head-to-head studies is that people who get steroids with tennis elbow, oftentimes they get better for a couple of weeks, but then don't always have a good long-term outcome. And so part of the way, one is, we have to diagnose you correctly and appropriately. How I do that is through diagnostic ultrasound. I love ultrasound because number one, it's so cheap. So it costs less than $100 to do an ultrasound compared to an MRI, which is oftentimes in excess of $1,000. Number two, there's no radiation with it. And number three, it's dynamic. So if you come in and you say, hey, Trevor, hey, Dr. Turner, my elbow's been bothering me. I've been crushing it in Halo, but I'm having a tough time with my elbow. What's going on? It's so easy for me not only to just put the probe right on you at the first visit, but then I say, look, Chris, why don't you do the thing that normally bothers you? And let me watch how your tendons or your ligaments change while you're doing that, right? And you don't get that from an MRI. You don't get that dynamic picture where we get to watch you and see you actually reproduce what it is that bothers you. So number one is we got to diagnose you really well. Number two would be is that we do have some long-term clinical studies now that do show that compared to steroids, that people who use, this is not the stem cell, but this is PRP or platelet-rich plasma. And platelets are cells that are routinely found in your bloodstream, but it's something that we harvest from your vein. So we do a simple blood draw. And then we use that in a centrifuge to concentrate it. So that's the machine that spins really fast so that we can get those concentration of platelets. And then we find that damaged tissue or that scar tissue under ultrasound, and we put those back in. And we know that at least over 82% of people who have that done for tennis elbow are going to have not only a good outcome in the short term, but a good outcome over a year. And so that's the difference to me and doing steroids for tennis elbow. Now, does that mean that nobody should get steroids for tennis elbow? No, I don't think so. But I think what it shows us is now the patient who comes in and says, gosh, I went to physical therapy and I wore a brace on my hand and I've been popping ibuprofen like candy or goody powders or whatever it is. And it's keeping me up at night. It's affecting me being able to use my arm at work or on the job or when I play tennis or whatever I do. I had a steroid shot and it helped me for a couple of days or just didn't help me at all. And what am I going to do? They tell me that I don't need surgery for this problem. And now we can say, look, not only do we have a great option for you, but we have an option for you that is going to give you long-standing relief and not just last for a shorter period of time. So I think, my goal is not to tell people, look, you should forget about all the things that everybody else has told you that can make you better. And I would say to you that, in the first place, when I see a patient in the clinic, I don't say, hey, let's do a stem cell procedure. I say, look, let's talk about what you've tried to get better. Because many times exercise alone or exercise in combination with some medicine or bracing will help people. And so, it's like we take an oath, like an Hippocratic oath, and we say, the first goal is to do no harm, right? And so as we kind of move through our paradigm of things we can offer patients, we know that as we get more invasive, typically that risk goes up. And so my goal is always to help people with the lowest risk treatment that's available to them. So.
Yeah, because a lot of times it's great that your company has that broad range where they can start with something, it's pretty non-invasive, and then of course you can escalate up there. My mom's, and for people that are out there that are having tendon issues, like say I am, one thing that some of the people were telling me was that if you don't get stuff like this fixed and it keeps on going, that the tendon damage can move up the arm and you can start having all sorts of problems. So if you're having this sort of tendonitis sort of stuff, or issues with your knees, et cetera, you really want to have worked on, because letting it go can make things worse. Is that correct?
Yeah, I think that's true. And I think also if you look at the data, I mean, so we're starting to get data, I'd say tennis elbow is actually a fantastic example. So I appreciate you bringing it up. And I have a ton of people come in for tendon problems, like with the Achilles, with their patellar tendon by their knee, with problems with these gluteus tendons in the hip that wrap around to the outside of the hip bone, as well as rotator cuff is a huge one. And then, you have the standard joint arthritis, shoulder, hip, and knee, big joints. But what we find is that when we use these cell-based strategies, like whether it's platelets or stem cell, the dramatic responders and the people who get 4 and 5 years relief, oftentimes it's because they're coming in when their pathology or when their injury is kind of early to middle stage. So people with moderate arthritis, they do fantastic. They do really, really well. As it gets more and more advanced, then I start to have this conversation with them where I say, look, I think that you can do better than you're doing now, but your expectations, your outcomes actually go down a little bit. And so instead of seeing, 4 to 5 years in relief, maybe we're talking about 3 years, or less. But it also depends on what people want to do, and the reason that I love seeing people from all different walks of life is, their goals are very different. And, so we'll have, a grandmother who says, look, I just want to be able to pick up my grandkids, or somebody's going to go on a big trip and they're going to travel and walk places. And then I have guys from, the military who are saying, look, I have to be able to jump out of a chopper. I have to be able to parachute down and land on the ground, potentially at high speed. I have to cover multiple avenues of terrain. I have to be able to rappel and carry an 80-pound pack while I'm doing this. How can you make my ankle stable? And that is fun. I mean, it's challenging, but it's really rewarding because you get to see people who have, different kinds of demands, and you have to tailor what you're doing to what their goals and their expectations are. I've never been sort of that kind of physician that said, sees somebody and then says, okay, look, well, you need to stop running. Or, okay, we need to quit doing that. I mean, that's just not good enough. It's not good enough for me.
Just don't move that elbow anymore and everything else.
Yeah, right. I mean, it's not good enough for me. And I mean, I was an athlete who was injured growing up. I mean, I played football in Texas in high school and loved it, part of my identity. And I remember the first time I herniated a disc, and that was a tough deal. And I think part of the reason I started to believe in the cascade of minimally invasive treatment is because I'm an example of it, right? I herniated 2 different discs, one playing in football and another kickboxing, and now I'm 35 and I've been practicing medicine for about 8 years, but I still do triathlons, I still do ruck competitions and things that maybe a lot of people who had an injury that didn't get good care wouldn't be doing. We're designed. I mean, we've evolved to be a species or a group of people who move. And movement is very therapeutic, and it's something that gives us not only a better quality of life, but oftentimes helps us find meaning, I think. And so we've got to focus on restoring those things that people use to derive meaning. And I think when we do that, then we sort of bridge that gap from somebody who's just maybe a doctor who quotes you statistics to somebody who says, look, I really had a connection with this person because they understand the things that are part of my identity and the part of the things that I have to do to be the best version of myself. And I think that's what moves us beyond just being maybe a doc to being somebody who's really a healer. So
that's awesome. And it's awesome you guys have the service there in Georgia and the facility to be able to do this, because picking your healthcare and getting the right doctor is important. I've found that over the years in my experience with doctors. One of my favorite shows to watch recently is Botched. And I don't know if you're familiar with the show, but it's a plastic surgery show, and they basically take people who went to bad doctors who botched their plastic surgery, and these I guess these Beverly Hills doctors or whatever, they try and see if they can fix what happened with the thing. And seeing bad doctors that don't give you the best advice and stuff can really take you down a road that is hard to recover from or hard to fix. And can be a big challenge. So you definitely want to be choosy about when it comes to your healthcare and the investment you make, and the quality of life as you get older is really important as well.
Absolutely. So I haven't seen the show, for the record, Chris, but I have heard about it because it's popular and people talk to me about the TV shows they watch when they come in. But I think, kind of an important takeaway from that too is that people are saying, look, procedures and getting sick, first of all, is scary. In the United States, it's expensive, and in many places, but especially here, because we're facing a healthcare crisis. Employers are trying to figure out how they cover rising healthcare costs for the people that they hire. And then people are looking for options that enable them to not miss work and still, be able to function and be a mom or a dad or do whatever it is that they, want to do. And the result is that if you have a bad outcome, that can last for a long time, and it can really jeopardize your ability to function. And so, that's why I loved kind of the whole residency in PM&R, or physical medicine and rehabilitation. I mean, it's kind of like almost like combining orthopedics and neurology. Not that we do all of what both of they do, but I think, we offer kind of a like an out of the box perspective to think of things a little more holistically, but have excellent training in anatomy and physical knowledge and work very well with the rest of a healthcare team. And so, I think the advantage there is that instead of saying, well, look, there's one way to do things, people come in with questions, and actually I love that. So I think people are better sort of informed than they've ever been before when it comes to picking healthcare options. I think the awareness of regenerative medicine is kind of slowly growing, but there's definitely a lot of misconceptions about, one, what's permitted by the FDA, and then number two, what it actually should be used for. And I only can speak to orthopedics in particular, but I think it's critical that we sort of get it right the first time around. Or if we see that unfortunate patient who's had a bad interaction with the healthcare system, we've got to work really hard a lot of times to reverse that, to say, look, if you come in the store, you're going to have a different and a better experience than you've ever had anywhere else before. And some problems are challenging more than others, but that's the expectation that we set here with our staff, and not just the physicians, but our extenders and people who meet you at the front desk and the people you talk to on the phone, and trying to make things, more convenient and desirable from a customer service perspective, I think, as well. Because, people, when they come into a physician, I mean, they're already, at least in my experience, I've been, kind of scared or nervous because something is being taken away from me. I mean, something's being threatened that I'm having a hard time doing. And then number two, I mean, when you're in that kind of vulnerable situation, I mean, you want to be treated with respect, and you want to be treated in a way that makes you feel valuable. And I think that's what people expect when they come here, and that's ultimately what they get, which is why they come.
Most definitely. And like I said, making a smart choice on picking who you, we've all had horror stories about doing bad doctors. And I think I'm a car crash person. So I always love cops, like shows like Cops or Cheaters, and Botched. I can't watch all of Botched because if I see blood or surgery, I can just start going, I can never be a doctor. This is no way. I got to hand it to you guys. Anybody who can see, blood and stuff, and the internals of whatever, God bless you guys, because you guys are brilliant in the science of all that. And I'd just be passing out all the time hitting the floor. But, my mom's gone through knee surgery on one knee. She had knee replacement. Mm-hmm. They told her that she's bone on bone. And I've always been like, what does that really mean? And you're talking about how there's a degeneration, and you can monitor, you can get an estimate on how much tissue is still in there. And I guess it does, in fact, become bone on bone eventually.
Yeah, I can. But Chris, you wouldn't believe how many people come in my office and tell me, hey, I've got bone on bone. And I say, okay, well, let's look, and even a simple x-ray will tell you about that. But we use my personal pattern is to use ultrasound a lot, very heavily, because I find things that other people don't find that way. Then we say, well, look at your pictures with me, because the pictures, that's the saying that a picture's worth 1,000 words. But we look at the pictures together, and a lot of times the people who've been told that they're damaged or they're bone on bone, or, they're just riddled with arthritis. I mean, we look at it and say, look, you have some disease here, but, this is not insurmountable. I mean, this is an amount of disease that we can treat, and especially now, maybe more than ever, treat effectively with either a simple platelet-rich plasma procedure, or sometimes compared with a bone marrow-derived cell injection. But I think, it's hard. I mean, you're having so many people tell you different things. And so, I think the great physicians are the people who are not just smart, because you do have to be smart. I mean, in the United States, it's very difficult to make it through the selection process. But, one thing that we're not always training people well for, and maybe we're not selecting out, is how to be a great communicator. And it's like one of the kind of the joyful moments for me is when a patient comes in and we have even just a first time consultation, and before they leave, they say, nobody has ever talked to me about all of that. And I'm like, well, that's kind of like, that's what you deserve. I mean, you're here in a vulnerable place, oftentimes, spending your hard-earned money to be able to understand, number one, what's going on. And then I believe that, the people who have good understanding, those are the people who do great, who have great outcomes, because you have to be able to understand what's going on to learn how to beat it. And the people who invest in that and take ownership in it, they really just do fantastic, I think. And so, and that's part of our mission, is enabling oftentimes people just to learn how to protect themselves and to learn how to be their own advocates and be sort of the best version of themselves.
Most definitely. And now with an aging, I mean, we're living longer and longer. I mean, I never thought I would have some of the issues that I had in my 40s and 50s. I've led a really healthful life. I rarely get like an infection from a flu. I'm going through a little bit of one now. So I'll get like a nasal infection or an ear infection, something of that nature, sometimes a viral cough, walking pneumonia or whatever. But it's really rare that I do that. And if I use antibiotics, I'm back in play. I think I've broken a toe in my whole life, but I've had this weird life where I've been very healthy, knock on wood, but I'm noticing that as I'm aging, like I'm having this tendonitis now and different things. And certainly as we age longer and longer, my mom's, I think, approaching 90. And so she's, well, hold on. I think she's approaching her 80s, 78. She's probably going to hate to hear what I just said. She's not there.
Don't let her watch this part of the podcast.
Yeah. I got to tell you, though, she is stronger than an ox. Like every morning she does 2 hours at the gym.
Wow.
I've tried working out with her and she will kick my butt. Like she's like that SCOTUS judge. What's her name? It escapes me now. She's a great judge. But anyway, she does a workout too. And my mom's like, if I don't do this workout, I tried working out with her. Oh man, I'm just tired. I get tired of watching her work out. And but she's not going down. And I don't think she's had a heart attack. I don't think she's had any real major issues other than these knees coming apart on her. I think years ago she had some wrists done with the carpal tunnel surgery. Yeah. She had that done. Yeah. But yeah, definitely as we age as a community, as a population, there's just going to be more issues that we're going to have because we're living longer, and somehow we got to get these little bodies to work for us.
Sure.
So give us your final sales pitch for coming down to the Georgia clinic there.
Sure. Well, I don't know about a sales pitch, but what I would say is I would do some things, we offer some things here that are really unique. And I would say that, number one, we're well established and we've been helping change this community for many years and doing so in a way that's very ethical. But we're very, very innovative here. So I think you'll meet a lot of people that say, why, I do stem cells or I do regenerative medicine because either they took a course over the weekend or they have a company that provides them with a centrifuge to do some studies in their office. But you're really getting something a lot more when you come here. I think the team overall is incredibly strong, and you're getting what's called a true bench to bedside approach, which means not only, if you come here for treatment, are we, doing things sort of in the context of what we call in the industry as a good manufacturing practice facility. But what that means is it's being done in a sterile hood. We're analyzing all of your cells before we put them back in a HEVO analyzer. And then we're keeping registry data. So we're keeping data about how well you do for how long, based on your age, based on what kind of disease you have. And that's what's going to change the world and change the industry. It's the people who are committed to the highest level of science and are going to do that to make patient outcomes better for the long run. And I think all of us here, we feel like it's just a great privilege to be able to do what we do. And I think the patients who come, they know. I mean, you can feel it when your physician is connectable to you and is passionate about what he's doing, compared to someone that maybe unfortunately is a little bit burned out or who's in it just to grind through the day. That's not what great medicine is about, and that's not what people find here. They find a beautiful product.
Plus, people have found that you're a great guy. You seem to really know what you're doing, and of course, that's a big thing in picking a great doctor and trusting them and all that sort of good stuff, and knowing what their knowledge is. I mean, I've met some old crotchety doctors that they kind of have a one-sided way of thinking, and I remember one time I went to a doctor for a burnt foot, and they were just insisting on that I needed to get a bone scrape, and I went to another doctor. He's like, you just need better penicillin.
Oh my God.
They wanted me to do a bone scrape at the hospital.
Wow.
Because it had gotten infected off a burn. And another doctor was just like, you just need more. I needed the silver stuff that you put on a burn. And then he's just like, you just need some more powerful antibiotics. So he did that for me. 3 days. Boom.
Wow.
It's better. And these other gentlemen were trying to do a bone scrape.
Oh my gosh.
So,
I'd be nervous if somebody told me that.
Who is good at what they do is really important. It's been a great exposure. Thanks for having us on the show. Trevor, give us your website one more time so people can look it up.
Yeah, sure. That's georgiaboneandjoint.org, or you can always find us on Facebook or Instagram as well.
Sounds good. And thanks for Trevor to be on the show. Be sure to check him out. Look at their website, all the good stuff. Refer it to your family and friends. I'm probably going to refer it to my mom, who needs her second knee replacement, or maybe we can figure out a way to keep her from getting a knee replacement because she doesn't want to do the whole knee replacement.
Sure.
But it's just so invasive. And it was tough to recover with the knee replacement. But I always tease her about how she's the new bionic woman. So there's that.
It sounds like an awesome lady, Chris.
She's wonderful. Thanks for tuning in to my audience. We certainly appreciate you guys. And give us a like, subscribe to us on YouTube, hit that bell notification. Be sure to refer the show to your friends, neighbors, relatives, and we'll see you next time.
Thank you. Do I need to say anything else, Chris?
Sorry, it's taking a little time to pull us out.
Okay.